tests, the basic information regarding the recent epidemic prevention and control. Now the floor is open. Please identify your media affiliation before raising the question. With Renmin Daily, National Health Commission in June has related the documents regarding the accelerating the PCR testing, and it's actually targeted the 8 groups of people. They are the key groups. So how's the work going on, and how we can evaluate the result of PCR, and how we can better control the epidemic based on the PCR results? Thank you for your question. I believe you asked 2 questions. Let me first answer your second question, how we can evaluate, or what's the role played by the nucleic acid test. Right now, the NAT actually is a very key indicator and also a scientific way to identify whether the person carried virus or not. That it also laid a solid foundation for us to resume work, production, market, and school. Therefore, in order to enlarge the NAT, we would like to intensify our work in order to promote the economic and social development as well as a orderly flow of population. So this is also a needed measure for 4 early measures in terms of early detection, reporting, treatment, and testing. Therefore, we talk about how we can improve our capability of NAT. That back to your first question. So in order to roll out our NAT to cover larger population, so the question is how. So we just for the sake of emphasizing, we should include more people tested, but that should also match with your capability of doing NAT, not just for the sake of saying it. Therefore, we accelerate our capability of doing NAT. The National State Council also issued a document in this regard. So based on this document, the localities also intensify their efforts to improve their capabilities. Regarding this document, I would like to emphasize 3 things. First, for the 8 key groups that should be tested, and also for the rest of people that are willing to get a test, the localities can, based on their needs of carrying out the work of epidemic prevention and control, they can lay out their own epidemic prevention and control, especially the NAT measures. That should be based on their local condition, that also in a dynamic manner. And second, based on the actual situation, they can have a top priority for getting NAT. So you need to have a list who should be on the top of the list. So yesterday afternoon, in the Beijing government report, they emphasize that they have a top group for NAT and also a layered targeted audience of NAT. So they have that method in place. And also we should intensify our efforts to build up that laboratory. So we talk about the level 2 hospitals, customs, as well as the border laboratories should be better improved. For some places, especially the coastal cities, they not have a strong capability in laboratory, also some remote places. So it's better not use the laboratory in order to avoid the inaccurate results. So from June 15th, we conducted a nationwide online training of giving NAT. So this is also with the help of National Health Commission as well as the Education Center, and also China CDC, as well as the clinical center from NHC actually compiled that document. And as of today, the noontime, so far, we have trained 360,000 people online. So we not only conduct this education online, there's also offline needed as well. So we also have the laboratory staff giving the help and the guidance online, and they also train the staff working in the laboratory in order that we can provide a full round help to improve the capability of doing NAT. CMG CCTV. So recently, the media and some institutions had that estimation that during the Dragon Boat Festival, we will see a boom in tourism sector. So my question is it right now good for our people to conduct a travel at their wish? So we just celebrated the May 1st Golden Week. Right now, we will very soon celebrate the Dragon Boat Festival. So for the May 1st holiday, with the great support of the State Council as well as localities, we have seen an orderly flow of the population, and we also tighten our measures in control of epidemic. That also help us to lay solid knowledge and measures to conduct epidemic prevention and control. So we will also give the guidance to the scenic areas, so help them to conduct the containment measures. So right now we have 10,000 scenic spots right now resume the operation. And for this holiday, we'll also conducted a staggered manner in order for people to tourist, that including in the following 3 areas. First, we will control the traffic. For the Dragon Boat Festival, the total method that it should be 30% of their total capacity of traffic. So the people need to book appointment online, and plus that limited traffic, the scenic spot can open their indoor areas. And second, we would like to bring everything with appointment. So this is also the concept we would like to promote, is that you should have an appointment before you arrived in the scenic spots. I also would like to see this can be a regular practice, except the elderly people or children. We also control the number of tickets as well as issued tickets. So this can be a hard line to control the traffic inside the symbolic area. And third, we also control the public gathering, especially at the entrance at a health checking point, the key areas of the scene, and also the narrow channeled catering areas. That is the places easy to have that public gathering. So we would also call the managers in these areas to put a close eye on the flow of the population. In order to let our tourists can have a happy travel, we suggest that everyone can get knowledge before they going out. So which means they need to have the knowledge of the epidemic prevention and control measures in that such area. And second, they also need to know the appointment practice. And third, also need to get the knowledge of the weather So we talk about that right now in the southern part of China. It's also in the raining season, so they need to get to know their destination's weather condition.
第五排最右翼的这位记者。
谢谢主持人，新华社记者提问。那我们知道，从疫情初期到现在呢，我国的核酸检测能力。
Xinhua News Agency. So from the onset of the epidemic till now, and we have seen a remarkable improvement in NAT as well as NAT results. And we also see that the officials actually released a list of NAT institutions for people to get a test. So we would like to know more about the NAT capabilities. Thank you for your question. As you mentioned, we talk about nationwide. Actually, we have seen that multiple measures have been taken in order to improve their NAT test. So we talk about NAT is a key technique based on the etiology. So we talk about the coronavirus is contagious. So we talk about people have contracted COVID-19 before they visited the hospital. They were the carriers, and they could be contagious to others. Therefore, based on the requirement of a national state council, and we actually give our key focus to improve the capability of NAT in order to cut off the transmission of the virus. Therefore, we would like to bring more people as possible to get a NAT. And for key target groups, they should be all bring to NAT without anyone unattended. And for people that are willing to get a test, they can book an appointment to get a test. And second, based on the needs of NAT, we also improve the infrastructure, equipment. So that's the hardware part and also the software part in terms of headcount and the people's skill side that all been intensified. And third, we also allocate more resources in order to improve the quality of the results. Right now, the capability of NAT compared to the beginning of March have seen a tremendous improvement. So from 2,058 institutions to 4,008, improved by 131%. So 2120, that's level 3 hospitals, 1350, that's level 2, and 148, that's from the CDC level. And talking about the people, right now we have 139,000 people to 5,000 people doing NAT, by 104% improved. So the institution's capability every day is 1.26 million, right now improved to 3.78 million samples, so 200% increased. As of April 24th, right now we have accumulated NAT tested is 90.41 million. So we can see this number improved a lot.
我了解的还是想有关于核酸检测的问题。那么现在呢，国际上已经将核酸检测作为一个重要的疫情防控的手段。
CMG, CNR, my question also regarding to the NAT, because this is a key way to identify the viral carriers. So we would like to know more why we conduct this nationwide or the large scale NAT and how we can improve the accuracy of NAT results. Thank you for your question. Regarding the purpose of giving NAT is very easy. Is we would like to do 4 earliest, which is early detection, reporting, isolation, and treatment. So for Beijing, since the outbreak of the sporadic infections in Xinfadi wholesale market. We found that the people worked for Xinfadi wholesale market, and also people have had travel histories to Xinfadi after May 30, and also give a large-scale NAT to the people living nearby compound in order to find potential risks, which also play a key role to contain the spread of the virus. Why NAT can play this key role? We talk about if it's a positive for the virus, then that's a reliable result. When we talk about whether we have that limitation, or we talk about that accuracy, it's a fake positive result, maybe, yes. So we talk about the PCR.
也就是说，在这个杯子里头，打个比方，我只有100微升的体积去反应，并且1万亿个分子，我把这1万亿个分子，这100微升里头倒到一个奥利。
That enlargement, we talk about that one particle, and we have that solution, and we bring, let's say, this glass of water, you put in a swimming pool.
所以说，它非常灵敏，对实验室的环境条件、对人员的能力要求都是比较高的，要有严格的质量控制。
So we talk about actually this is very sensitive. So we talk about the virus actually very sensitive to solutions. So we need to have accurately control the whole process of getting the virus and also to getting the knowledge. So we need to control the way of people getting the samples and conduct the sample results. So we talk about the fake negative, we talk about when is the time we get that sample from the patient. We talk about in the incubation period. So that's the on-site of the infections. Let's say this time we have people that already carry the virus, but they visited the hospital 8 days or even 14 days after the on-site period. So it's really hard to get the result of NAT. So when is the best time to get NAT result? We can get 100% accurate positive result. That is the end of the incubation time period or the early time period of on-site. So we talk about which way is the best. Actually, we talk about the plan is the best. It's better than the nasal swab. So we talk about how you can conduct the swab. That's also a very key way. So we talk about the cell of the virus. You should get that sample of the cells, right? And also we talk about the reagent. So we have a different reagent with a different sensitivity. So we talk about the methodology actually also impact the final results. Another issue is we need to think about the mutation of the virus, because right now with the development of the virus, so it's very easy to have that mutation happened. And we talk about if the virus mutated, but the swab sample actually didn't get that sample. So we talk about right now our reagent also have the 2 targets or 3 targets reagent that can help us to improve the results of accuracy.
谢谢主持人，我是中国日报记者。近期各地的核酸检测人员和设备陆续进京。请问这些检测队伍进行到北京
With China Daily,
工作任务和目的是什么？谢谢。
right now we have seen the more and more equipment as well as headcount conducting NAT arrived in Beijing. So can we know more about details why these group of people and also the equipment arrived in Beijing? Yes, indeed. As you mentioned, we have allocated and mobiled 12 teams from the 12 provincials arrived in Beijing in order to improve the NAT needs. That's also based on the arrangement of the State Council's joint prevention and control mechanism. Therefore, in 2 batches, 20 teams of NAT arrived in Beijing to work with 8 hospitals under NHC as well as 12 hospitals in Beijing. So 125 for the first batch, 201 staffs for the second batch arrived in Beijing. They are not just the NAT testing personnel. With them, they also brought 90 sets of NAT equipment, which means for each hospital, they can get 4 to 5 sets in addition to improve the capability of conducting NAT. So for the first group arrived on the 20th in Beijing. So 10 teams working in 10 hospitals in Beijing, right now already in the full operation. So the capability for these 10 hospitals improved to 580,000 samples. So in the recent 1 to 2 days, the rest 10 teams will also get started. So talking about this time, for Hubei, actually has dispatched 3 teams from Huazhong Science and Technology Chongji Hospital and Xiehe Hospital, as well as Renmin Hospital and Zhongnan Hospital. So we talk about back to February and March, Beijing actually sent the medical teams to help Wuhan, and this time Wuhan paid back to Beijing and working with their colleagues in Beijing. We believe this is also the time to showcase that we work together for our people, reflecting that the advantage of our political system, and also show very strong mobility capability of allocating resources.
谢谢中新社记者。这个端午节假期，因为有很多人都有这个出行的计划，所以想请问一下，因为存在这个不同风险等级，地区之间就有大量人员流动。
For Dragon Boat Hospital, the holidays, a lot of people actually have their traveling plans, but actually that also involved a different population flow from a different level of risks in terms of an epidemic. So do they need to be quarantined after they getting back to their home or getting back to the places they're working? Thank you for your question. Tomorrow is the traditional holiday of Duanwu, or the Dragon Boat holiday, and this is the second long holiday after the normalized practice of the epidemic and prevention and control, and this is also the holiday after the Beijing cluster of infections. We believe that's another test to our epidemic prevention and control measures. We will see a spike of a population in scenic spots, in flights, train, and we will also see the increase in consumptions. Looking the whole world, right now there's still a growing number with an average of 100,000 cases per day globally. So we also face the risk of imported cases. Therefore, we call on everyone to better protect yourself. The State Council on May 8th issued a document regarding normalized practice of epidemic prevention and control. Inside this document, actually, they had a very solid and detailed requirement on the individual and companies' responsibilities. So this emphasizes the companies and also the people involved should know their role and responsibilities, and they need to know the epidemic prevention and control measures, and also they have the way to deal with the cluster infections, and also need to establish the mechanism of normalized practice of epidemic efforts, and also call on the NAT capable institutions should also play their roles in order to avoid overwhelmed hospital. And third, we should also intensify our efforts to do the more education to the public. We just released the A65 campaigns, make sure that it's easy to understand and easy to use. Therefore, we can equip our public with more knowledge and know-how. And we also discourage people to conduct unnecessary outdoor activities. If you have to go out, please get knowledge ahead of the time of your destination in terms of epidemic prevention and control. If your destination is the high-risk places, we discourage your visits. And also, please protect yourself by wearing masks, keep your hand hygiene, keeping social distancing at least 1 meter, and also don't conduct a public gathering. And no group dinners. And if you show the symptoms such as a fever or coughing, please cancel your travel and visit hospital as soon as possible. And also, please work out to have a healthy routine. So we talk about whether you would like to go back home or that you go back to the place you work. They need to conduct an NAT or they need to quarantine at home. So in the documents released in this regard, we talk about all the quarantine practice should in need of the epidemic prevention and control. So people from Beijing from Beijing, they need to conduct the quarantine. For other places, it's not necessary.
谢谢中央广播电视总台国广记者提问。今年的端午假期呢，正值咱们有一个常态化的疫情防控这么一个特殊的背景。那么呢，南方多地呢也陆续进入了这个
CMGCR.
想问一下咱们这个文旅部。
So for this holiday, actually that also coincide with a special background of a normalized prevention and the control measures. My question to the travels department, what kind of measures in place to protect the travelers? Although for the long holidays, just 3 days, but under this special time period, also with special meanings, which means we should give a top focus on the control measures. So we call on all the localities to firmly practice their jurisdiction responsibilities, monitoring the safety. That also should be their responsibilities, as well as the company's responsibility. They should find out the potential risks in order to let our people to conduct a safe travel. We have conducted the following. First, we have released a notice in this regard, asking the localities to fulfill their responsibilities in controlling risks, because right now it's also a flooding season. So we also call on the companies as well as localities to put a close eye in this regard to find out the potential risks. And the second, for the transportations, we ask the travel agencies to check their suppliers of transportation, especially the certificates of drivers as well as the car companies. Make sure that company and drivers should be reliable, and we should overhaul the markets of the car renting market, as well as to find out the potential risks. And third, regarding the catering service, so we talk about the whole process of food, from purchasing to the transportation to storage and to the cooking. The whole process should be traceable, and also the people involved in this whole process should conduct the health check.
设施设备的自查，
Fourth,
对受疫情影响处于停业状态，
we talk about
长时间没有
the
维修保养的设
equipment
备，
involved, such as the tunnel and also the other equipment in the scenic places or the equipment that had not been used for quite a long time. They should also evaluate the
我们向社会
safe
发布了游客
standards before putting
借
it
此
back
机会呢
to
我们再次向
operation.
广大游客呢做出端午节出游的提
Fifth,
醒，
we also
疫情
issued
防控不麻痹，
a notice to the
游安
public.
全不大意。
Therefore, I would like to
请广大
once
游客
again
密切关注各地疫情防控
urge
部
our
门
public,
发布的疫情风险
please
信号
keep high alert to the safety of travelings, and also please get a full knowledge about your destination's epidemic matters, and also
在乘坐交通
abide
工具
by the rules and regulations of your destinations, and also protect yourself
一定的监督
against the virus. When you taking transportation or traveling inside the specific areas, please keep social distancing,
出游前
and
通过
also
全
for
文渠道
the
查询
eating
开
and the
放
caterings, also please keep a distance and also use
旅途中要合理的规划旅游线路的
the chopsticks to share the
那么游
food,
览时呢要遵守景区的规定，间隔入园，错峰
and please have a plan ahead of time in order to manage your routes of traveling as well as timeline, and also we encourage the people to conduct staggered
遇到恶劣天气，
travel manners,
应避
and
免到
for
山地
the areas not capable to receive travelers,
游玩。
please do not go there.
谢谢刘科
And
长
if the weather condition is not good enough, please do not go to the places that easily to have a risk, such as places nearby the lakes or seas or mountains.
凤凰卫视的记者，近期呢，我们可以看到有很多民众就反映，有的地方的卫健委就要求
Phoenix
住
TV.
院检查或者是住院的病人呢，也需要做核酸检测，并且还
Recently, we have seen some people saying that the local health commission asked people to go to the hospital for NAT, and also the people hospitalized as well as their family members also need to get tested. And we talk about the not only for NAT, that also should plus IgG and IgM, as well as the CT scan should also be conducted. Thank you for your question. That's a very good question. Just now, my colleague just mentioned that NAT actually is very easy for us to identify the carriers of a virus as well as to cut off the transmission of the virus. So it plays a key role in the 4 early measures. We talk about right now, we also have the asymptomatic carriers, so that's also easy for us to identify the potential carriers. And also for some patients, they also may be a vulnerable group of COVID-19. Therefore, we ask localities, while practicing normalized epidemic control measures, should also intensify their efforts to screen the potential patients. Therefore, in the document issued by the National Health Commission, so based on the local condition, they should have a solid understanding of the local condition in terms of COVID-19. And for 8 key groups, as we mentioned many times, we talk about people with fever, the newly hospitalized people and their family members, the people working for the medical institutions. They should be all tested. For the rest people, if they are willing to get a test, then they can get a test. So the purpose of doing so is to find the potential risks of transmitting the virus, and as soon as possible, as early as possible, and also identify the patients of COVID-19 inside the hospital. So this is a very meaningful practice. Therefore, we also call on the local health commissions
好，谢谢郭艳红女士。下一个问题，
should facilitate the service
第5排
for
第
the
二位
patient.
谢谢郭艳红女士。
谢谢香港中评社记者提问。有网民反映，一些地方对外地，特别是北京的返回人员，无论是否核酸检测结果是阴性，都一律集中隔离14天。
So some
那有网民
netizens
隔离期间甚至被要求做
mentioned that
收费检测。
no matter the NAT result is negative or not, the people had the travel history to Beijing and they should be quarantined and also need to do 4 tests, and it's not free. So we would like to know whether it's necessary, and can we know that NAT results, when is the time that NAT result can be recognized across different provinces? So we talk about no matter people back to Beijing or people leaving Beijing should all conduct 14-day quarantine is not a correct practice. How we do this, actually, the national government as well as Beijing government all released the document in this regard. We talk about the people from the medium and high risk areas as well as the people related to Xinfadi wholesale market. They should be tested. That had a clear requirement in the document, and we talk about the people related to the medium high risk areas in Beijing. They are not allowed to leave Beijing. For the other people, they should not conduct unnecessary travel leaving Beijing. And also they have to go out. They should have a valid NAT result no older than 7 days. So we talk about if you have everything plus a green code of your healthy apps, then you are free to travel. So you do not need to be quarantined for 14 days. So the destination government should not impose the additional requirements. For people, if you cannot provide the valid NAT results no older than 7 days, then you need to be tested in your destination. If your test result is positive, you should be quarantined and receive treatment. And if your result is negative, and you should not be quarantined. For people under centralized medical observation, on March 31st, State Council already released the document. It's already available to the public online. So it has requirement of 7+7, so the quarantine for 7 days, 2 NAT, and then 7 days stay at home. In total 14 days, so that's 7+7. So which means that if you're under the medical observation for 7 days, that's first 7, and you will receive the NAT on the 3rd and 5th days of your quarantine. If it's all negative, then you come back to home for additional 7 days quarantine. So you talk about the incremental test requirements. You should have a clear explanation. And we also talk about the cost expenditure at the Commodity Price Department should also follow the rules for the illegal behaviors that should be corrected. Due to the interest of time, now the last question, please.
近期我们大家在出境的时候都需要有1周内的核酸检测报告，但是我们有网友也反映，现在的核酸检测的门诊的号源是1号难求。
We talk about that the NAT result no older than 7 days is required. We talk about right now, actually, we cannot book an appointment for getting the NAT, and also the NAT result arrives really late. Sometimes when we receive that NAT, that's maybe just a valid 1 or 2 days. So we talk about what else we can do to improve the capability of NAT and what measures we can do to shorten the results of NAT. Thank you for your question. That's also in our consideration. Indeed, in Beijing, we have seen a sharp increase in NAT results. Actually, we talk about the capability of doing NAT in Beijing is much higher than the other places. And we talk about the people actually in Beijing. They divided in two groups. For people, they have to do tests. This is the one group. Another group is people willing to get a test. So that is basically the reason for the delayed results of NAT. So National Health Commission have do the following two areas. First, we have dispatched a team of experts. Mr. Jingming actually involved in this special group. So this group actually provide the guidance to the Beijing team. And second, we give more support and help to Beijing. So as I just mentioned, the 20 teams from 12 provincials arrived in Beijing to help improve the capability of NAT in Beijing. We also dispatched the P3 laboratory to Beijing, and we also constructed laboratories. And the Tianjin and Hebei also involved in this regard to help to do the sample tests of NAT. Right now, we have seen 98 institutions in Beijing right now improve to 120 institutes for NAT. The daily capability of doing NAT reached 400,000 samples. If we talk about the key groups, they will be in the separated channel. For people in low-risk areas, they will have a mixed results. So far, right now, our capability reached 1 million people. We believe with different channels of support, with different measures taken, we will very soon see an even larger capability improved in this regard. Thank you. This is the end of QA, and thank you all the speakers and friends from the media. Thank you.